button.
8:25.
Now, NHS services across England could be dramatically cut as part of an efficiency-saving plan. The BBC has seen proposals which include cuts to bed numbers and changes to care provided by GPs and A&E departments. Let's talk to former Health Secretary Stephen Dorrell. Morning to you.
Good morning.
What do you make of these plans from what you've heard of them?
Well, what I think is going on is not so much cuts as you described, because we need to remember all the time that the budget, of course, there are great pressures in the health service, but the budget is growing, albeit slowly. What we're seeing happening in the health service today is something that's been talked about for many years, which is to try to improve the links between NHS hospitals and the surrounding social care services and primary care services in order to ensure that people don't go to hospital when they don't need to, and just as importantly, when they don't need to be there anymore, there is proper support in the community to allow them to be discharged.
Well, that's one bit of it, but it's not just that, is it? I mean, this document says, for example, in Leicestershire and Rutland, there's a proposal to take the number of hospitals from 3 to 2 in the Black Country. They're reviewing an A&E department. This isn't just about managing the people in the system. This is shutting services down.
Well, the Leicestershire health situation is obviously one that I know reasonably well, because I was a Leicestershire MP for over 30 years. And there's been talk of reshaping the hospital service in Leicestershire for the whole of that period that I was an MP. The reason for it is simple, that if in Leicestershire or another part of the country there isn't sufficient resource committed to social care, to primary care, to delivering community services, too many people end up in hospital unnecessarily. And what we should be doing, and this isn't a controversial view, it's not even it's not a political view, it's not a view attributable to a particular government. It's something that's been talked about in the healthcare system for years, that hospitals are run too often as islands divorced from from primary care, from community services, and from the rest of local public services. And of course the system's under stress, and I think it's well documented that the resources available in particular to social care aren't sufficient to allow proper care and support to be delivered.
Okay, Stephen
But what is starting to happen is that the health service is becoming more embedded in local services, and that, I think, is a good thing.
Stephen Dorrell, former Health Secretary, thank you for your time this morning on 5 Live Breakfast. 28 minutes past 8. We've been bringing you this story as well this morning, the news that hundreds of shops have been closed down in the first 3 months since the so-called legal